is a practical tool. So it came out during the process. It shouldn't be an abstract philosophical tool. It should be a practical tool that helps you, whoever you are in the healthcare environment, to plan your patient engagement project, to assess the quality of the patient engagement in your projects. That could be prospectively, that you really assess, are we on the right track? Or it could be retrospectively to say, let's learn from what we did, and let's learn from that, and let's assess it, or we can use it as a way of assessing each other and benchmark each other and become better. Because that's the important part here. It provides the structure and the framework for everyone to work together to collect the outputs, the impacts, and lessons learned in a structured way. So we can learn from our projects and build on that knowledge and share across stakeholders. 7 guidance criteria were identified ultimately, were distilled down from all the wealth of information that sort of tied together and covered the basis, so to speak. And what is important here is that for each of these 7 criteria, there's an entryway in the guidance where you can either say, I'm going to do a patient engagement project. What's my next move? Or I've done one. How can I evaluate and learn from what I did versus these criteria? So there's 2 different entryways depending on your starting point, regardless of which stakeholder group you belong to. And what I find very valuable for this in my situation as well is that it's very focused on asking questions. So it's really about asking the right questions when you're engaged in a project.